This week on Healthy Living, Mpox spreads across Africa, keeping health officials on high alert. Research veterinarian Dr. Mercy Akinyi shares insights on the Mpox outbreak and offers protective measures against the virus. And the malaria parasite is showing signs of resistance to artemisinin, threatening malaria control efforts. All this and much more in this edition of Healthy Living. Hello, I'm Linoch Moudou. Thank you for joining us for another edition of Healthy Living. Mpox is spreading in some countries in Africa. Formerly known as monkeypox, Mpox is a contagious rash illness caused by the monkeypox virus. The disease causes fever, muscle aches, and large boil-like skin lesions. According to the World Health Organization, over 4,250 cases have been recorded in 10 African nations, including Burundi, DRC, Ghana, Nigeria, Rwanda, and South Africa. At least 456 people have died. In the DRC, children are at risk of infection with Mpox as a new variant spreads through some camps. Since last September, cases have surged in the country due to a strain of the virus, and the disease is crossing over to countries nearby.
The scars of Mpox are still visible on the face of 7-year-old Grace Kabuo here in Goma. Grace, among the first confirmed cases, is now recovering, but the virus's impact is spreading alarmingly. Grace's mother, Denise Kahindo, says she's still unsure about how her daughter was infected.
I don't know how or by whom my child had been contaminated. I just watched helplessly as the symptoms appeared on her body.
The World Health Organization says that more than 11,000 cases and 445 deaths have been reported in the DRC this year, with children being the most affected. Dr. Pierre-Olivier Ngajole, a medical advisor for charity MEDAIR, says over 130 suspected cases have surfaced in this former Ebola treatment center, predominantly in children.
Out of these, 50% are even less than 5 years old. Up to the age of 18, that's 95% of the cases. So you can see that the over 18s are just 5%. The most common route here is direct contact from a sick person to a non-sick person.
Formerly known as monkeypox, Mpox is an infectious disease caused by a virus transmitted to humans by infecting animals that can also be passed from human to human through close physical contact. Health officials now face a new challenge with a variant that's proving more transmissible, particularly among children.
Children can also affect each other because of their close contact, playing together or sharing the same living quarters. So we do expect to see children, but we hope that those cases at least can be detected quickly and given the appropriate clinical care that they need to reduce pain and reduce the length of illness and avoid complications and long-term sequelae.
Amid efforts to contain the outbreak, officials are grappling with limited resources and the urgent need for international support. There are no vaccines or specific treatments available here outside of clinical trials.
And we hope that, especially in the camps, we'll be able to organize contact follow-up with community relays and community leaders, as this is how we hope to break the chain of transmission. Otherwise, it'll be difficult for us to break the chain of transmission.
African health officials have announced a dramatic 160% spike in Mpox cases this year alone. The virus has now spread to at least 10 African countries, with Congo bearing the brunt of the outbreak.
Dr. Mercy Akinyi is a research veterinarian based at the Institute of Primate Research in Kenya. She discusses Mpox and shares some steps to protect yourself.
So Mpox is a viral disease, and it's caused by the monkeypox virus. And this is a virus that is in the family that is similar to what people know as smallpox. The real reservoir is not known, but it is found in monkeys, as the name suggests, but also in rodents as well. And so, as you have said, the transmission is two ways, from animals to humans and from humans to humans. And when we look at animals to humans, it is mostly transmitted by cases where humans interact with animals. As we know, there are people, especially who live where humans and wildlife interact. There have been cases where people eat bushmeat. And so the people who will eat meat, probably meat from monkeys, we have had research in the past where we ask people whether they have eaten meat from monkeys, and the answer is yes. This is a contact disease. So either you're in contact with someone who has the rashes or fluids from their body if you're having sex, if it is pregnant women, and they can pass it to their unborn child. So really, and if you've even touched contaminated surfaces that have the virus, and maybe you have a cut in your body, all of this can contribute to human-human transmission. These are definitely different viral families. But one of the things that I can say is for a lot of the what we call emerging infectious diseases, a lot of them are caused by viruses, and they kind of will have symptoms that are similar. So a lot of them have flu-like symptoms, because even for Mpox, you've had them say there's nasal congestion, coughing, and things like that. And then Ebola also has the flu-like symptoms, the fever, the chills, the lethargy, the fatigue. I'll go right ahead and just say there's no treatment for it. There's probably 1 or 2 studies that are ongoing that are based on treatments that were done for smallpox, but there really isn't a treatment. And with most viral diseases, what you treat is normally the symptoms, right? So if you have a rash and it gets infected, bacterial infection, then that means you'll be giving antibiotics to clear the bacterial infection. With regards to vaccines, I think there's at least one vaccine that has 2 doses that can be given, and these are probably given to people who they're at risk, or they are most likely to go to areas where they can be prone to get the monkeypox. A lot of this, it's hygiene. That's what I can say. Hygiene, wash hands, eat well, have sufficient rest, keep away from other people so that you don't spread it. But currently, no treatments.
The malaria parasite is showing signs of resistance to artemisinin in parts of Africa. It is the main drug used to fight the disease. A new report warns of potentially millions more deaths without immediate health policy changes. Henry Ridgewell has more from Bangkok.
It's estimated that over 1,000 children die every day from malaria in Africa, and there are fears that the death rate could rise. Artemisinin combination therapies, or ACTs, have been the cornerstone of malaria treatment for 20 years, but there are worrying signs that they are becoming less effective, says report co-author Lorenz von Seidlin of the Mahidol Oxford Tropical Medicine Research Unit in Bangkok.
We have increasing reports from Eastern Africa saying that they have documented resistance against the first-line treatments against malaria.
Artemisinin-resistant mutations have been detected in more than 10% of malaria cases in Ethiopia, Eritrea, Rwanda, Uganda and Tanzania. Before artemisinin, chloroquine was the most widely used medicine to treat malaria. The report authors note that in the 1990s and early 2000s, signs that the malaria parasite was developing resistance to chloroquine were widely ignored.
When the chloroquine resistance slowly sneaked into Africa, there was a whole wave of childhood mortality followed by it. So really a large number of children, probably in the millions, died because chloroquine didn't work as well as it used to do. And now we see these first signs that something similar is happening with the ACTs. And that is, of course, very worrying.
The paper, published in the journal Science, urges policymakers and global funding bodies to act now to prevent artemisinin resistance taking hold. Their recommendations include combining artemisinin drugs with other medicines in so-called triple artemisinin combination therapies.
Ultimately, there was an understanding that this could be a major health emergency globally. And so there were a lot of investments from funders from high-income countries towards these countries in the Greater Mekong sub-region to stop the spread of artemisinin-resistant parasites.
Scientists say that sense of urgency must now be applied to tackling artemisinin resistance in Africa. Henry Ridgewell, VOA News, Bangkok.
Did you ever take antibiotics to treat the flu? If yes, you are not alone. However, get this, according to medical experts, antibiotics have no effect on the flu because the flu is a viral infection. Antibiotics work by killing bacteria or stopping them from multiplying. So, what is the difference between a bacterial infection and a viral infection? Here is what experts at US-based Mayo Clinic have to say. Viruses are tiny, simple organisms that consist of genetic material encased in a protein coat. They require a host cell to replicate and cause infections such as the common cold, influenza, and HIV. Antiviral medications are used to treat viral infections by stopping viruses from replicating or entering cells. These drugs often rely on the host's immune system to clear the infection. Many viral infections resolve on their own with supportive care and the body's immune response. Bacteria, on the other hand, are single-celled microorganisms that can survive independently in various environments, including the human body. They can cause infections like strep throat, urinary tract infections, and tuberculosis. Bacterial infections are typically treated with antibiotics. However, antibiotic resistance is a growing concern, necessitating careful use of these drugs. Some people who have lost the ability to speak can still move their vocal cords. California researchers are working to transform those muscle movements into audible speech. Ginny Adulo reports from Los Angeles.
Engineers at the University of California, Los Angeles are developing this device to capture electric signals produced by the muscle vibration of the vocal cords. Researcher Ziwan Che is using artificial intelligence to transform those signals into speech.
That electric signal will be fed into the actuation or the loudspeaker part, and then the loudspeaker part will give out the sound. So that the whole process from sensing to processing and then to actuation realizes the ultimate goal that we're trying to do, like help you speak without using a vocal fold.
The magneto-mechanical membrane converting vocal cord muscle vibrations into electrical signals is soft and stretchable, so it can be worn comfortably. They mixed magnetic nanoparticles with soft polymers and shaped it using traditional Japanese paper cutting technology, says researcher Jing Xu.
We made the MC layer with kirigami pattern, which make it even soft.
Researchers are training artificial intelligence to recognize vocal cord muscle vibrations of different people. Jun Chen leads the project at UCLA's Samueli School of Engineering.
Your muscle vibration could be totally different, right? So we have to train the device before it's really used. And then we will analyze those electric signals first, and then to build up a personalized this kind of vocabulary database.
Designed to help people with various speech disorders and pathologies, Chen says he plans to test the device in his own lectures, which can run as long as 3 hours and sometimes strain his voice. Jenny Adulo, VOA News, Los Angeles.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.